patient leadership programme was grown out of the need for patients to be really involved. We really wanted a voice from the patient that was meaningful and not just tokenistic. It's been running for 4 years now, and over the 4 years we've used each cohort of patients and carers that have been working with us. They come up with a design of a project, and seeing that project come to fruition makes me incredibly proud. We've now got nearly 40 patient leaders. We have a variety of ethnic backgrounds, disabilities and ages, and it is widespread across the whole trust now, you know, having a patient leader on a project.
I got involved in the patient leadership journey from the very beginning. And Sharon Heron had this vision about authentically engaging patients in everything that we do. They were at the forefront of all that we wanted to do, and how could we do that with the concept of patient leadership. So she kind of shared that vision with me, and immediately I came on board with that. And our patient leaders are just brilliant in that they come on board already with a wonderful set of skills, qualities and attributes through their own experiences of being patients or carers of patients. So they've really had to, quite often through their conditions, had to change their direction, navigate systems, make complex decisions, problem solve. And these are all wonderful leadership skills, and it's fine-tuning those so that they can use those and apply those effectively in our trust, working alongside us to improve patient experiences across our organisation. It's just an absolute privilege and a pleasure to work alongside leaders, whether they're patient leaders or clinical leaders. And with our patient leaders, it's just the joy of seeing the difference that they actually can make. And usually it's the small things that make the big difference to improving the patient experience.
Patients, sometimes they can't talk very well. Sometimes their brain is affected, so they don't get proper speech. But if you introduce them to music, they can sing. I had an elderly patient, the very first one I attended, who hadn't spoken at all. She just had a blank look, and we had a seaside theme. And it came to the songs, I do like to be beside the seaside, and I was holding her hand. And also I felt her hand move, and I looked at her, and her mouth was also making, well, so she didn't have the words, but she was humming along. I got emotional with that when I saw it, actually. At the end of it, when she went back to the ward, they reported that she was brighter, and within weeks, she was allowed out of the hospital and back to the home that she'd come from.
We always have a patient leader on our consultant panel, and while we ask them questions about their professional work and their leadership style, it's important the patient leader asks them questions about how they respond to patients, how they respond to relatives. Compassion is one of the values of the Trust, and we want to be absolutely sure that we're offering the most compassionate care that we can to our patients.
So for me, it's a really good way of meeting other people that I wouldn't interact with normally, and hopefully making a positive contribution to the hospital and to Reading as a community. I play both the piano and the cello, so I'm really hoping to come in on some of the elderly wards and play for them, and just kind of have a chat, really.
So John is my patient mentor, and I have the opportunity to talk to him about some of kind of my role and the leadership decisions, but importantly to directly get his take on the experiences he's having has been really kind of transformational for me. He is a really significant source of advice, guidance for me, and it feels a real privilege to have someone like John as a patient mentor, and to really get underneath what compassion means from the patient's perspective and from the patient carer's perspective as well.
I'd like to consider myself a friend of Steve's as well as a patient mentor, and I think that's where it works for me. Is we talk openly, you know, we have a little chat about everyday things, but then we sort of home in on the things that I see on my normal patient mentor role around the trust, or who I hear from other patients, or even friends and family. What's nice about working with Steve is he listens, paraphrases it back to you, and then suddenly you realise Yeah, that was exactly what I meant, you know, and it's been really good, and he does listen an awful lot. I've seen some of those things that we have discussed in our meetings develop into, you know, new services or just the way you go about doing things. So I feel that we, as a patient leader or patient group, are being listened to and things are being acted upon, which is great. You know, it's everything I could have wanted.
So one of the projects I've been involved with is patient acting, to help with the training of overseas nurses. And week on week you see their confidence grow as they get to practice interacting with a real person in a safe environment. It's hugely important how we deliver compassion, because there's a big difference between a person who is medically experienced and able to deliver that expertise in a caring way that makes patients feel reassured and comforted at what can be quite a frightening time.
Well, I always saw my role as a patient leader as the voice of the patient, and it was decided that I should do many ward audits designed around the problems that my husband and I had when he had a cruel stroke. He was on the wards for 8 months. I was supported to do this until I felt confident. Discovered a couple of problems that I could help with, which did make me feel as though it was all worthwhile.
Well, the project I'm currently involved in is Dress for Dignity. I am the wardrobe manager. The Dress for Dignity room is a benefit for patients ranging from young right through to old. It's because, for instance, if they have their clothes cut off, you know, in A&E, they have no clothing, and then you'll get patients where they've lost a lot of weight, so the clothes they have at home are too big. So again, they can come in here and, you know, choose a wide range of clothes for home.
We established the ward accreditation programme about 2.5 years ago now, and we set it up specifically to be a mark of excellence to which our wards could aspire. We have been very, very clear to involve patient leaders in assessing wards for excellence. We review a portfolio of evidence which covers all of the domains of the CQC. What the patient brings is a completely different perspective, so they help us really assess whether the care on the ward is compassionate, whether it, from their perspective, is safe. And what they bring that's really unique is they see things completely differently to how I, as Director of Nursing, see them. So they will pick up anomalies or things that I would never even have thought of, and we then get the opportunity to explore those things further.
I had cancer, and while I was being diagnosed, it took a long time to diagnose me, and so I saw lots of people in clinics and lots of doctors. I often met people who couldn't communicate with patients, and that's not good. I was asked to become a patient leader, and while I was training, Moira, my mentor, said to me, have you seen this website? And that was about Kate Granger, who then had terminal cancer. I hadn't seen the website, but it was about Hello, My Name Is. Kate Granger was really annoyed that staff didn't introduce themselves to her when she was being treated, and I felt fantastic. I'm allowed to be annoyed too, because I was really annoyed, and I decided to do something about it in this hospital. I went and saw Caroline Ainsley, the executive, and she said, come and talk to the board, which I did, and they said, go ahead. Thereafter, I've talked to, I don't know how many hundreds of staff here, and eventually patients started saying to me, everybody introduced themselves, everybody said who they were and what they were going to do to me. So I felt as though I'd made a difference.